Did you know that not everyone with high cholesterol has heart disease, and that not everyone with heart disease has high cholesterol? Well, it's definitely true. There are so many other factors that come into play when it comes to cardiovascular disease risk. Of course, we want to look at the lipid panel, right? It's not to say we ignore cholesterol and triglyceride levels. We want to look at those. Your LDL cholesterol, which is typically known as your bad cholesterol, though, is not the only player in the game. Triglycerides, which are typically known as your blood fats, if those are high, that is another increased risk factor for cardiovascular disease. And if your HDL, your good heart protective cholesterol, is low, that also increases your risk for heart disease. And then there's a lot of other factors, like what's going on with inflammation, right? What is that HS, our high sensitivity CRP, doing, your overall body-wide marker for inflammation? If that's high, that can be another risk factor for cardiovascular disease. How about blood sugar? What's your fasting glucose, fasting insulin, hemoglobin A1C, which is a 3-month marker of blood sugar? What are those like? What are your lifestyle factors, right? How are you doing with nutrition and exercise, sleep, toxin reduction? What are your stress levels like? What's your social connection like? All of those things matter when it comes to cardiovascular disease risk.